Hey, well, let's go ahead and get started. I am JC Abu Said. I'm the CEO and president of Halbert Hargrove, and I have the pleasure of welcoming Nicole Amico Kane again. She's the director of care management at Aging Wisdom. Nicole brings with her a couple decades, more than a couple decades of experience in her work as a care manager, helping consulting families and providing guidance on how to best navigate health and memory changes as you age. So she oversees a team of care managers in the greater Seattle area. And Nicole and Aging Wisdom have been working with Halbert Hargrove for more than 15 years. And it's been a very rewarding relationship. We've helped clients and we've helped friends navigate through this topic. Just a reminder, we had Nicole last summer. The virtual event that she did was the power of planning and taking control of your aging journey. Today, we're taking kind of a slightly more concentrated focus on one of those journeys. It has to do with dementia and how that affects you, your family, and our clients, of course. So a quick housekeeping. We do have a Q&A box, so we want to take your questions there. You can type them in as Nicole is giving her presentation, but know that she will answer and we'll engage in a good dynamic Q&A session at the end of the virtual event. And without further ado, Nicole, again, thank you for joining us and take it from here. Thanks.
Thank you so much for the introduction, JC. It's great to be back again. As a consultant, I help families and individuals with a variety of things regarding their long-term care planning and aging process, but I have a special love and niche in working with people who are impacted by dementia. So it's always very satisfying to me when people show up to learn more about this topic. And I think it's probably important to say, I think we have a diverse audience today where I know some of you might already have this happening in your life in some way. Some of you are other professional advisors who want to learn more about how to navigate this when you see it showing up in your clients. And I think some of you are here just to be proactive and learning more about this. So I'm going to jump to my slides. And again, welcome to have a discussion and answer questions at the end. First, I thought it'd be helpful just to give some background and context on dementia and why it's so important to all of us to be more informed on this topic. I'll go through some statistics. Almost 11% of people over age 65 live with dementia. 33% of people over age 85 have dementia. And I'll say there that a lot of people ask, what causes dementia? And there's a lot of different things that cause dementia, but I will say that age is the biggest predictor, and people over age 85 have a higher risk of developing dementia just by age alone. Those living with dementia may need long-term care services anywhere from 2 to 10 years. I've certainly seen longer. And when we say long-term care services, I mean either bringing in care at home or making considerations for moving to someone to assisted living, memory care, skilled nursing, etc. And I think an important consideration here is thinking about taking care of someone for 2 to 10 plus years, the financial impacts involved in that, thinking about sustainability of costs over time, and also the huge impact on family caregivers who play a big role in this. And that sort of segues to the next thing I'll talk about, whereas unpaid family caregivers provide 18 billion hours of care in the US each year. And if you know someone that's a family caregiver of someone living with dementia, or you happen to be a family caregiver yourself, you know the tremendous toll that this can take on people. Between now and the year 2060, rates of dementia are expected to double. And there's a few different reasons for that. One, I'll say that we are far better today at detecting and diagnosing dementia, so those numbers are bigger. Secondly, we know that our aging population is growing. And then third, people are living longer. So when you think back to this statistic of people over the age of 85 being at higher risk for developing dementia, it's easy to understand the reasons why these numbers are going up. What I see come up a lot when I meet with people is a little confusion around what's dementia, what's Alzheimer's disease, are the terms interchangeable? So I just want to take a minute breaking that down a little bit. What's important to know is that dementia in and of itself is not the disease. Dementia is considered a syndrome. The disease is actually what's underlying that causes the dementia. So dementia, you can think about it as an umbrella term. So people who have cognitive and memory changes that can't be attributed to anything else, that are starting to cause interference in their life. And when I say interference in their life, I mean they can no longer take care of themselves. They're having trouble paying their bills. They're not remembering appointments. So if the memory and cognitive changes are causing interference in their daily life and function, they have dementia. That is the very definition of dementia. And then to think beyond that, dementia can be caused by a variety of underlying pathology, and that can be Alzheimer's disease, it can be Lewy body, it can be Parkinson's disease dementia, it can be vascular dementia, frontotemporal, and a host of others. I would say these are the more typical ones that you tend to hear, but there's a very, very long list of different types of dementia. And as research has gotten better, we've gotten a little bit better at being able to discern the exact type. I will say, however, that diagnosis is still not perfect. So it's hard sometimes to know exactly what type of underlying disease is causing the dementia. Sometimes it's just looking at symptoms and the progression. The other thing that's important to know, especially for people of advanced age, is that a lot of times it's not just one type of dementia. It's what they call a mixed dementia. And the most common type of mixed dementia is Alzheimer's disease and vascular dementia. So you have Alzheimer's disease pathology, but you also have vascular components. And that's usually caused by things like you've had a stroke or you have long-term chronic cardiovascular illnesses that have not been well controlled, like diabetes, high blood pressure, high cholesterol, things that can cause vascular problems. So a lot of times when you hear people talk about dementia, we talk about memory. I think it's important to emphasize that dementia is not just memory. People that often have Alzheimer's type dementia, it's probably more typical with those folks that memory is oftentimes the first noticeable symptom, specific to short-term memory impairment. So people that are starting to get forgetful, they're not remembering names, they're getting their dates mixed up, they're sort of in a loop on conversation, repeating the same things over and over again. Those are what I would say more typical noticeable symptoms that are most likely, not always, but most likely related to Alzheimer's disease. The flip side of that is problems with long-term memory. So long-term memory meaning, someone of later age, they can remember stories of their childhood. They can talk about their early adulthood and their career in raising children. Typically, we don't see long-term deficits in memory until, I would say, typically the middle to later stages of the disease. Other cognitive functions that are impacted by dementia, I think it's important to talk about that because as you're thinking about yourself or various people in your life, It's important to know that it can show up in a lot of different ways. And I think people that don't have a good understanding of all the different ways that it could show up, I think sometimes what happens is there's a change in behavior, something seems a little odd. It's definitely different than how the person typically presents, but you're not quite sure what's going on there. One key cognitive function that can be impacted is the ability to learn information, new information. And I think this is important to think about. For example, if you're a family care partner and you're supporting somebody who has cognitive changes, sometimes I see family members getting frustrated because they're trying to teach new tricks. Mom can't remember, the doctor's appointment I scheduled for her. So I got her a new calendar, or I'm leaving Post-it notes. And sometimes people are surprised to know that those strategies that are so helpful to us actually don't work, because that is a new system or a new piece of information that someone just may not be able to adapt to. The ability to reason, problem solve, and evaluate options. This really ties into what we call the executive functioning parts of someone's brain. And I think this is especially important to highlight because, again, there's not always a typical with dementia, but I would say I see this more with people who have vascular type dementia, where they might not necessarily have noticeable memory issues. So these are the people that present normally, they're still taking care of themselves, they still can be independent in a lot of ways, but the people that know them the best start to see some behavior that might deviate from what's typical for them. I know that we have some financial advisors in the audience today, and I think this is especially important for those folks to know, because I think that financial advisors in particular can oftentimes be at the front lines of noticing some of these changes, especially when you have a long-term relationship with a client, their behavior around their finances, and then all of a sudden they're coming and they're wanting to do things, especially, let's just say in these economic times, perhaps, they're starting to do things that deviate from what you would normally expect of them. And so if this is a person that's trying to do that of advanced age, you might start to question whether or not they're starting to have some executive functioning deficits that might be impacting their judgment and their sort of higher level thinking skills. The other thing that we can see is changes in sleep patterns, certainly mood and behavioral changes. Depending on the type of dementia, mood and behavioral changes can be the first symptom before anything else, especially people impacted by dementia at a younger age, whether that be young onset Alzheimer's disease or frontotemporal disease. I think we know this a little bit better now, but in years past, people in their late 40s, 50s, 60s, still working in relationships, they would start to demonstrate behavioral changes that some people would attribute to, gosh, do they have a drinking problem? Are there substance abuse issues? Is there a mental health issue happening here? Only to learn later that it was actually a neurodegenerative issue that was happening that was causing dementia. For people of later age with, say, more typical Alzheimer's disease, we start to definitely see mood and behavioral changes in the middle to moderate stages. Difficulty getting through a sequence of steps to complete a task. So you think about someone paying their bills, sitting down, looking at a bill, writing out a check, putting it in an envelope, putting it in the mailbox, somebody following a recipe, tasks that seem relatively simple to us. People might start to have difficulty getting through all those steps. The ability to manage finances and make complex decisions. We talked about that a little bit already. There's a lot of literature that suggests that financial capacity can be one of the very first skills to go before some of these other symptoms might even be noticeable. So obviously that's sort of another sort of heads up and red flag for those of you helping people with their finances, to, really do your best to try to make sure people have, their systems set up appropriately, that there's good safeguards in place to try to avoid errors, mismanagement, being exploited, etc. People might also have changes in their language, and this can be, having trouble finding the right words. It could be having trouble expressing themselves in a clear and linear way. It can also be a comprehension ability where you're saying something to them and it's clear that they're not processing the words. Some of you, probably know, Bruce Willis, as a celebrity, he was diagnosed with primary progressive aphasia, which often has a language, verbal language component to it as the first symptom. Visuospatial changes can be a component in any type of dementia, and essentially what this means is people's ability to kind of know where they are in space. So we think about this with people being safe in their environment. They may not have as good peripheral vision, or they might not be able to see that curb to step over the curb. So thinking about people's driving safety, people's ability to be safe in their homes. And then we'll get into the stages a little bit more, but in moderate to advanced stages, dementia will have impact on people's physical abilities as well. So that's when people are at the stage where they're going to be dependent on either a family caregiver or long-term care services, because there's going to now be a decline in their ability to take care of themselves, meaning help getting dressed, help with their bathroom hygiene, help with grooming, things of that nature. So as you can see, lots of different ways that dementia shows up, not just memory. Next, I'll go through the stages. When you think about the way that dementia progresses over time, and dementia is a progressive illness, I think of sort of 4 ways it presents. One, for people who start to notice changes in themselves, or maybe they have a family member who's noticing that and kind of nudging them to go meet with their doctor and have an evaluation. If they're in the very early stages, they might get a diagnosis called mild cognitive impairment, or MCI. And some of you have probably heard this term, and I think there's a lot of confusion around what it means. It's not necessarily early stage dementia. I think of it more as a pre-dementia. So in a cognitive screening, someone with mild cognitive impairment would not score appropriate based on their age and level of education. So it's clear through that screening that there are some cognitive deficits happening. However, it's not causing interference in their life, meaning they can still take care of themselves and be independent. So it's not yet dementia. And the thing to know about mild cognitive impairment is that it may or may not progress then to be dementia. And I think the crux there is figuring out why the mild cognitive impairment is happening. Is it something that can be resolved? Or is it sort of a kind of precursor to a more progressive dementia process? Some of you also may have heard about a newer drug called lecanemab, is the most popular one. This was developed, I think just in the last couple years or so, relatively new, showing more promise than typical drugs intended to treat dementia. The thing to know about lecanemab is you may or may not be a candidate. One, you have to be at the mild cognitive impairment stage. So if you are beyond that and it's already starting to interfere in your life, you're not a candidate. And there's a lot of testing that needs to be involved to determine whether or not that's a real option for you, and lots of considerations. It's not a miracle drug like some people think. It doesn't reverse the illness. It doesn't stop what's happening. It merely slows the progression. But again, it's only available to a small number of people. And people may or may not opt to even do it if they are a candidate, because it's a very rigorous process that requires a lot of discipline. So there's definitely a benefit versus burden consideration there for lecanemab. So if you are past the mild cognitive impairment stage and now you have dementia, again, meaning that your cognitive and memory issues are impacting your life and your ability to take care of yourself, there's mild, moderate, and severe stages. And I'll just go through the sort of typical characteristics of each one. But again, I think it's important to remember that it's not going to look the same in every person. It's not always linear. And that's going to be dependent on the kind of dementia that someone has, in addition to what kind of care and support they're receiving. Do they have unmet needs that are sort of exacerbating all of this? And then also, what's their bigger medical picture? You know, if they have other diagnoses and other medical conditions impacting them, the stages might look a little different or go in sort of a different order. Typically in mild to early stage, there's trouble with short-term memory. People are getting forgetful, repetitive, having the same conversations over and over again, starting to forget appointments, not tracking, you know, what day it is, what time it is, more confusion, trouble finding the right words. Typically people at the early stages, they might have various impacts in their life, but physically are typically still able to take care of themselves. If I'm meeting someone and they're still in the mild to early stages of dementia and taking care of themselves, I think the biggest thing that I focus on is how to prevent safety issues. And the biggest focus there is driving, their ability to manage medications and stay on top of that, and finances, kind of going back to what we talked about, like even in the early stages, financial capacity can very much be impacted. Moderate to middle stage, if you think about what we just talked about, typically all of that is starting to look a little worse. And then you might have some additional symptoms popping up. More increased confusion, starting to interfere in how you get through your day. The middle and moderate stage typically tends to last longer. Mood and behavioral issues might start to pop up. This is where we see people perhaps getting a little more anxiety, you know, as they lose control of themselves, lose control of their environment. That can cause anxiety. Sometimes we see more challenging behaviors such as paranoia, suspiciousness, irregular sleep patterns. And then if people are at the stage where they're starting to need care, sometimes there's resistance and agitation around accepting that help. Also in the moderate to middle stage, if people in the early stages did have awareness of some of these changes that were happening with them, a lot of times we see them lose that awareness in the moderate stages. And this is particularly difficult for the people around them that are trying to support them, because they are trying to insert themselves in a way that protects that person's safety, is trying to address their well-being, but it's very hard to do for someone that lacks that insight. So that's actually a big focus of the work that we do with families, is providing a lot of education around what that means to not have awareness. And I think it can be a big shift for family members to really recognize and embrace that concept, because a lot of times what we see is family members getting very frustrated. Asking, can you meet with my mom and please help get her to understand that she has dementia? Can you help her get past her denial? That approach is really, one, not appropriate for someone at the moderate stage of dementia, because what you have to understand is that those parts of their brain that control self-awareness is just not there anymore. So attempts to try to convince them of what's going on, convince them of the help that they need, it really just escalates the situation and causes more resistance, and then you're not able to really accomplish anything productive. So a lot of the work that we're doing is focused on helping family members change their approach and not being so frustrated because they think, well, mom's just stubborn, she's in denial. Maybe you have a stubborn mom, but I don't think she's in denial, because in order to be in denial, you have to be aware of what the issue is. And people in the moderate stages just aren't even aware of the issue. So really important concept there to understand. A lot of times at this stage, we're starting to see a decline in people's ability to take care of their personal care, what we call activities of daily living, dressing, bathing, toileting, mobility, etc. Certainly at this stage, people do require assistance and oversight with their appointments, their finances, their transportation, and medications. So this is, where we come in to help people understand what those options are. And then lastly, the, severe late stage, components, people typically at their stage are more confused. They're unaware of their deficits, so they're not addressing them on their own. They really cannot participate in healthcare or financial decision making. So this, hopefully the planning around that, the estate planning was done long ago, because at this stage, they've passed the window to be able to have enough capacity to execute legal documents. Things like walking, swallowing, speaking can all be impacted. Typically at this stage of dementia, someone's requiring full-time care and supervision, whether that's in their home or in an appropriate care facility. People are also more compromised at this stage. So you hear of people in the later stages of dementia getting, urinary tract infection or pneumonia, something that, somebody else might be able to easily recover from, but they just might not have the physical resources anymore to recover from those types of issues. A lot of the work that we do at this stage is helping families think in advance what the goals of care are. And what I mean by goals of care is thinking about what makes sense in terms of medical. So what types of medical interventions are a benefit versus a burden for this person? And that's when we think about, is it time to think about more of a palliative care focus, or is this person perhaps nearing the end of their life where hospice services might be the right approach and provide the necessary level of care they need at that point in their life to ultimately be comfortable and being able to die on their own terms. So next, I want to shift into talking about diagnosis, because I think there's a lot of confusion out there around, where do I even start? I'm noticing changes in my husband, or I'm noticing changes in my dad. What do I do with that? There's not necessarily a standard of care in the healthcare system, and I think that's what can be really frustrating for people. But ultimately, my advice to the families I work with is that the conversation needs to start with the primary care physician. So ideally, people have a trusted relationship with the primary care physician, and I understand it's getting harder and harder to access healthcare services. And so that's not, I acknowledge that's not as easy as it sounds. We've seen a lot of people in the healthcare industry retire and could sort of move on since early COVID. So a lot of people who had a trusted primary care physician, they've retired or left the practice, and so they're having to kind of start over. But that relationship with the primary care physician is so very important to start the process of diagnosing cognitive and memory concerns. A good primary care physician should be able to do enough of an evaluation and an assessment in the primary care clinic to determine is there a problem or not. Any primary care physician should be able to administer a cognitive screening, which should only take about 10 minutes. There's a few different ones out there. And obviously, the gold standard is one called the MOCA, and that's MOCA. So if you're someone that's worried about memory changes in yourself or in a family member, you can go to the primary care doctor and say, can you please do a MOCA screening? It's a very sophisticated screening that's not going to tell you everything you need to know, but it is going to be able to provide some good feedback on, is there a problem here? And if so, then we need to figure out what we do next. First and foremost, and this is the reason you start with a primary care physician, is to rule out other potential causes. It could be medication side effects. There could be a vitamin deficiency. If it's someone that's using excessive alcohol, that alone could be contributing to memory and cognitive problems. Sometimes untreated mood disorders like depression, anxiety could be masking as memory issues. There could be an underlying illness that's causing confusion. In very rare situations, there's, something more serious going on like a brain tumor, but I would say that's typically an outlier. So first and foremost, rule out anything underlying that can be treated and reversed to clear up any of the memory and cognitive issues. The second piece is to make sure you're treating modifiable risk factors. So cardiovascular, chronic illnesses like diabetes, high blood pressure, high cholesterol, obesity, sleep apnea. Those are the big ones that come to mind, that treating those alone and managing those over your lifetime, one, that's going to help prevent dementia. And if you have dementia and you have those issues going on as well, if you're managing them optimally, you're not going to have an unnecessarily rapid progression of dementia, more than likely. And then through that process, the primary care physician can hopefully make a judgment to say, okay, we've ruled out everything underlying. We know there's a problem here with your memory. What do we do with it? Sometimes it makes sense to then refer to a neurologist. I will say, if you're helping anyone in that process, absolutely make sure that you're seeing a neurologist that specializes in cognitive issues, because neurology is actually a bigger field than what everybody realizes. And I think it goes a long way to see somebody specialized in dementia. I'll also say that you can prepare to wait sometimes 6 to 8 months to see a neurologist. And that's why not every primary care physician can have the expectation that a neurologist is going to deal with this. So that's why there's more and more effort being putting into making sure the primary care physicians can address this within their clinics, because it's just not an option for everybody to see a neurologist. Also, it may not even be necessary if it's something more typical like Alzheimer's disease. I think really the neurologists come in when there's a more complicated issue going on, when a scan needs to happen to rule out that there's not something else happening in the brain that needs to be addressed in a different way. Or especially if it's a younger person, someone before 65 presenting with memory and cognitive issues, that's a little bit more complex. So certainly that person needs to see a specialist. And then I'll just run through some ideas around how to think about, okay, we have a diagnosis now. And what do we do with that? Like, how do we move forward? Because I know for a lot of people, they feel like that's the support they don't get through the healthcare system. We saw the primary care doctor, we saw the neurologist. My sister was diagnosed with Alzheimer's disease. We basically got a diagnosis, and now what do we do? One, you can consult with the healthcare provider on whether medication options make sense. We talked a little bit earlier about lecanemab, which has more promising results, still very limited, but only available to a very select group of people who are in the pre-dementia stage. Beyond that, the jury's sort of out on whether or not the medications we have on the market do a whole lot to help slow progression of dementia. I think what we have seen to be more promising is that they might not necessarily change what's happening with the cognitive decline, but it might help with other things, such as preserving a little function, maybe helping address anxiety, helping address some of the mood and behavioral issues. But certainly a consultation to talk through the pros and cons is absolutely a great use of time. Some people decide to take no medications, and that's certainly a reasonable option too, as long as you feel you've gotten enough to make an informed decision about that. We talked about this already, making sure you are addressing other medical conditions, because unstable medical conditions, including mood issues, depression, anxiety, etc., those are going to exacerbate what's happening with your cognition. So improving those alone might create sort of an overall better picture. This seems, some people might say this is insignificant, but proper dental care, vision, hearing has huge impacts on helping people maintain function, even in the midst of having dementia. So making sure you keep up with those appointments. There's actually a lot of research on hearing loss. Hearing loss, even at a younger age, if that is not addressed properly and optimized, hearing loss alone can be a predictor to having later cognitive problems. And there's lots of options. I work with a lot of older clients who don't want to wear their hearing aids. They hate their hearing aids. And there's actually a lot of different ways of thinking about how to improve their hearing without using actual hearing aids. So I guess the big tip there is to not ignore that as an issue. And then I also want to talk about just staying connected. I think, after the early stages of the COVID pandemic, we learned a lot about the unintended effects of social isolation. It's unfortunate we had to learn it that way, but I think what we know now is that meaningful engagement, having a community, staying connected is a huge predictor to health. Overall health, cognition, all of the above. I'm fortunate to live in an area where there's lots of different resources for people to be connected, even if they don't have local family, friends, or relatives. There's a senior center in every neighborhood, lots of opportunities for people to join various support groups. One of the conversations I have with my clients is helping them think through the pros and cons of aging in place and staying home, or moving to a retirement community. And obviously there's a variety of considerations that goes into that, but one of the big ones is thinking about what kind of support system they have. If they don't have a support system or feel connected in their neighborhood and community, sometimes that's a big consideration for moving to a retirement community where that's built in. In addition to connection just being a way to improve people's quality of life and well-being, we also think about vulnerability. So people who are aging, starting to have memory and cognitive issues, if they don't have trusted and reliable people around them, that's when we start to worry about vulnerability, where people either are not taking care of themselves, properly because they can't. We also worry about people being vulnerable to things like scams, undue influence, being financially exploited. So again, making sure that people have eyes on them and have a support system around them. Goes without saying, maintaining exercise, meaningful engagement, nutrition, all those things important. And then, the other thing that I think is of great importance is recognizing that if you're supporting someone with dementia, there's a lot of decisions that have to be made along the way. And I think it's especially valuable for people to figure out how to mobilize their team so that as you're getting to the various stages and you're having to explore, I'm seeing this new need now, how is this need going to be met? Making sure that you have guidance, education, support along the way to know what are the best options for me. Also, I think for people, especially when I think about married couples, that shift that happens where, maybe in their relationship, they made decisions together all throughout their life. And now the person caring for someone with dementia is more burdened by having to make decisions on somebody else's behalf. And sometimes there's, doubt, guilt, a whole lot of things that comes along with that. So I think it's important for people to have outside support, outside consultation, to be able to feel like they are not alone in that decision making. Like all the things that they're doing on someone's behalf is being done with the right information and guidance from professionals who understand their situation. And then the last thing I want to say, and this is kind of like step 0 before all of this, even before step 1, is just those fundamental aspects of good planning. And the very most important thing there is to make sure people have done their estate planning. And when I say estate planning, I mean making sure they've designated their surrogate decision makers, they're, under a power of attorney, to make sure that you have someone to act on your behalf for healthcare decision making as well as financial decision making. And then making sure that the people that you've named make sense, and these are trusted and reliable people that are going to be able to carry out wishes on your behalf. And for some people that don't have somebody in their life to be that trusted and reliable person to act under a power of attorney, they're at least where I live, there are professional fiduciaries that can serve in that role. So that's a reason sometimes people are reaching out to us proactively. I know it's coming down the road. I need to do my estate planning, but I don't have family to rely on. Or, gosh, maybe my son lives on the East Coast, and honestly, I'm not sure he's quite the one for this role. So who do I look to do that? And that's the role of a professional fiduciary. Okay, last thing I want to go through quickly is just making sure you know all the various resources available to you. We were just talking about mobilizing your team and making sure you know where to go for information and consultation. And all of you should have these slides so you can go to these websites if you find that helpful. Aging life care professionals, there's a national network of people just like myself that do this work, where they work with people individually to help them with their planning. That's aginglifecare.org. So you can find someone in practically any state doing this work. Elder law attorneys, so elder law attorneys, these are the folks you would be connecting with to do your estate planning documents. And typically what I say to people is if you did your documents, great. But if you did them 10 years ago or more, you probably need to pull them out of the drawer and look at them, read through them, make sure they're updated and they still make sense. And then elder law attorneys can also be a resource to people if you're dealing with more complicated issues in your life where you're concerned about an older adult being taken advantage of, or there's, for example, family conflict that's getting in the way of the care of an older adult. Elder law attorneys are fantastic resource for that. Senior and community centers, there's typically a social worker connected with any senior center. So if you're starting to have concerns about yourself as an aging person or somebody else, and you're just not even sure where to start, I would say start there. And they're usually a great resource getting you pointed in the right direction. Alzheimer's Association has a variety of resources on their website, in addition to a directory of support and educational groups. Same with the Dementia Society of America. And then the Elder Care Locator, that's a little bit of a bigger network where if you're trying to figure out housing options or financial resources for people who need care but have limited resources, that's sort of a good sort of place to start that can hopefully get you pointed in the right direction. And my information should be on the slides that all of you received. If you have a question or you're trying to find a resource in your area, you are sure welcome to reach out to me, and I'll do what I can to make sure you get connected in the right way. Thank you so much. That concludes my slides. And now I'll just see if we have any questions in the Q&A. Okay, let's see. I have a question from Michael. If a person is just over 80 years old and has a rather long surgery, 3 to 4 hours under general anesthesia, what is the probability that the person increases their chances of getting dementia as he or she gets older? That is a great question. I'm not sure if I can quite answer likelihood of developing dementia. I will say there's a high likelihood that that person might develop what we call delirium. Delirium meaning they might present with confusion, less function, etc., as a result of being under general anesthesia. Typically, delirium tends to be a little bit more short term, but sometimes what we see, and this kind of gets at your question, is that the delirium doesn't quite clear. The acute symptoms of the delirium might clear, but you might see that that 80-year-old who just had a very long surgery, maybe they can physically recover from the surgery, but you might see their cognition not get quite back to their normal baseline. So that's a great thought around, you know, someone at 80 or older deciding what is this surgery, you know, what are the pros and cons of doing this surgery? Is this a necessary surgery? Is this elective surgery? I think it's a great question to ask of the doctor, you know, what can I expect at my age and with my medical picture in terms of how I'm going to be impacted by anesthesia. So I don't know that I quite got to exactly your question, but hopefully that was helpful. Are there any resources to test cognitive memory impairment before seeing a doctor? And are there tests that start with a baseline and then track the pattern over a period of time? I don't, here's what I'll say. All of the cognitive screenings that we know about, so there's the mini mental status exam, there's the slums, there's the MOCA. Those are sort of the 3 key ones. Anybody can go online and print these forms and test yourself. Do I recommend that? I'm not quite sure because I am not I'm not convinced that it would yield anything useful. I think if you are someone that's concerned about your memory, it absolutely makes sense to go and see a specialized provider, primary care physician or otherwise, psychologist, your therapist, someone that can be more objective in administering that screening. And then the second part of that question, are there tests that start with a baseline and track the pattern over a period of time? Yes. So I talked about the MOCA exam being the kind of gold standard screening. So typically what happens is if someone's concerned or they just want to be proactive, hey, can we do a MOCA? You do the MOCA, and then if you go in for your annual exam, your Medicare wellness exam, you can do that over time to see how that score is changing. So the MOCA can definitely be used in that way. Have you seen any cases where a fistula is treated and cognition has improved? That would be a question for a doctor, and I am not a doctor. So I am sorry, I can't even take a stab at that one. To clarify, the fistula is on the brain, thank you. Yes, I don't feel like I can take a stab at that one. But I think if that's an issue, hopefully this person is connected with a specialized neurologist that can talk that through. And again, if, this is something that you're struggling with and you feel like you're not quite finding the right provider, I can certainly see if I can offer any assistance in that area. Great. I think that's all the questions we had in the Q&A. I don't think I'm missing anything, right? Yeah. Great.
Yeah, Nicole, thank you. You're right. I don't see any more questions coming in. As we wrap up, maybe we'll give a little bit of time for any more to come in, but we did record the virtual event, and we'll make the recording available in about 2 weeks. That'll be emailed to everybody that registered. So anyway, great content, Nicole. Very informative. It's a difficult conversation. It's a difficult subject to navigate. We really appreciate your guidance and wisdom. I think we are definitely wrapping it up. Oh, wait, looks like a question came in. Hold on. Yeah, no, it's just a comment. So, anyway, I think that's it, Nicole. Well, again, we appreciate everybody's attendance. Oh, wait a sec. I think I do see there's a couple questions that came in.
A couple questions. Okay,
Yeah.
let's see. I think I just lost my Q&A. Do you mind reading them, JC?
Not a problem. So the first question is, for a company, what services do you offer?
Oh, what services do we offer? So we offer consultation and ongoing care management. So consultation is where we sit down with an individual or a family to do a deep dive in what their concerns are. And some people, again, are thinking proactively. They're people that are past retirement, still doing well, but they're like, hey, I know the road ahead. What do I need to start thinking about now for my aging process? Other people are reaching out to us because they're concerned. So that's typically an adult child, maybe a spouse. My mom's health is not doing well. I'm noticing changes in my husband, and they want really tailored guidance on how to navigate that. So that's our consultation piece. And then some families hire us to do what we call ongoing care management. So that's where we are advocates for our clients. We're getting them connected to the right doctors, to caregivers, helping them think through, is it time to move to assisted living? And then we can actually take on some of the role of, say, what an adult child might do for their parent, or what someone might do for their spouse. So we can accompany them to doctor's appointments, be that advocate, track information, etc. And that's, also the services that many of the aging life care professionals provide as well. That's that national network that I was talking to you about. So depending on where you live, you should be able to find someone that does this work.
Very good. The next question is, can triggering events such as death in a family cause a temporary loss in memory? And it's the idea of, can stress cause temporary loss of short-term memory? It's a clarifying question that follows.
Yeah. Yeah, great question. I think absolutely it can. Um, I think we talked about that a little bit, where sometimes mood issues, depression, anxiety, certainly grief, especially if it's prolonged and complicated grief, can mask itself in a lot of ways. So it can cause, reduced function, changes in memory, changes in, sort of overall cognition. So, if that's a concern for you, I think absolutely to see if that person can get connected with the right provider to figure out what kind of support they need to deal with the grief, in the hopes that that might, one, just improve their well-being and quality of life, but help, improve function and cognition overall.
Very good. Let's see here. I'm not seeing more questions come in. I know you provided, your contact information, and Aging Wisdom information is available in the invite and what have you. So if anybody has any additional questions, or questions you rather specifically direct to Nicole, you know how to do that. Or you can come to Halbert Hargrove, we'll route it to Nicole and we'll take care of it. So again, I want to thank everybody. I want to thank Nicole. Great presentation. Thank you for joining us today. It was a great virtual event. And again, recording will go out in about 2 weeks, and we'll see you on the next one. Thanks,
So
everyone.
much.
Thank you, Nicole.
Bye-bye.